Smooth.
Okay, I'm Dr. Castanet, and I'm here to explain the Med-X cervical rotation machine. Marianne's going to be our model for today to demonstrate how this works. By the way, I'm a little reluctant even to show you the machine because it looks like a torture device, I'm told by most patients. It is, however, reasonably comfortable, and it does what needs doing. Patients that need to do this are people with neck pain, they've had a trauma, they actually sometimes just on a degenerative basis. They may have limitation in their range of motion, they may have pain particularly more on one side than another. They need to strengthen and rehab tissues perhaps that were torn, such as in a trauma, if it's not a degenerative problem. Oftentimes accidents will result in asymmetric vectors of injury or force that tear muscle and ligamentous fibers. When that happens, of course, tissues heal with scar tissue. In fact, you should know that in auto accidents there is typically some tearing of muscle and ligamentous fibers. Those heal with scar tissue, and oftentimes there's some contracture or shortening of the tissues afterwards, and as a result function is compromised and movement is painful afterwards. You've got to rehabilitate those joints and those soft tissues that aren't functioning properly, and you can't do it through just time and neglect. You have to address the problem with very specific rehabilitation to get those muscles and ligaments and joints to stretch, contract, and move the way they did before the traumatic injury. Even for degenerative conditions, often people are stiff, and this helps with that, sometimes dramatically. But it's a good thing to try for anybody with a neck problem for whom it's not contraindicated. Anyway, what we have here is Marianne is secured to the machine. We set it up so that she works through the range of motion that is comfortable for her. Oftentimes it's limited after an injury to a much lesser range of motion, but that generally improves as you rehabilitate the tissues so that over time patients will move further and further in each direction. We can also apply the appropriate load and resistance. That generally gets better over time also so that they get stronger in the soft tissues. And generally people that are treated with this respond favorably from the first treatment. It is in fact what they need, and as a result you're rewarded with improvements in range of motion and less pain generally from the first visit or first treatment session. Right now Marianne is working from the right to the left side. After the person does that, we'll stop. Okay, Marianne, you can stop for the moment, and we'll set the range of motion up the other direction so that now she can lift the resistance coming in this direction, the other way. Go ahead and try that. Very often in people with injuries to the neck, there will be a disparity from side to side so that one side is weaker and more painful than the other to do. That also tells us a lot of valuable information about the limitations and the deficits in the range of motion and strength and about the injury itself. And it doesn't just reveal it to us, but also to the patient. So the patient then has a real visceral sense of how they are limited and how they've been injured and what the difference is side to side. And they're encouraged because over time that disparity will diminish and they'll be more equal side to side in terms of the range of motion and the pain. And nothing makes a person happier when they're in pain and they're disabled than regaining that function. It makes you grateful again for the function that we take for granted when we're not in pain and disabled by injury or degenerative changes. So that's the explanation for Med-X cervical rotation.